Would you like to learn how to have strong, healthy teeth?
Teeth. You can use them for anything, from opening bottles to husking coconuts, or even as Christmas gifts. But even if you just want to do normal food stuff with your teeth, you're still going to want to go to the dentist every once in a while. Unfortunately, for a lot of people, that can be kind of tough, because an estimated 68.5 million adults in the US don't have dental insurance, which is more than twice the number of people who don't have regular health insurance.
Downward on the upper teeth, count to 10.
Now, health insurance covers your whole body, your heart, your skin, your bones, but not your teeth. Your teeth have a different insurance. You go to a different building for your teeth, practitioners go to different schools. So you have this bifurcation of medicine, which at best is an inconvenience. And at worst, patients seriously suffer, which is why some people highlight the need to put the mouth back in the body. So today I want to look at how the mouth left the body and what have the consequences been. This is Chapin Harris and Horace Hayden, early American dentists. Hayden learned dentistry from George Washington's personal dentist, and Harris studied dentistry from his brother. But neither went to dental school because there were none. Anywhere in the world, no dental schools yet. In the first half of the 1800s, dentistry was very different. At the time, a lot of dentistry was just extracting teeth or filling cavities with molten alloys. Teeth cleaning wouldn't be a thing for like decades. So dentistry was more of a trade. There used to be something called the barber surgeon. And these were people who would do things like tonsuring, which is shaving the bald spot in a monk's head. They might apply leeches if it looked like you needed them. They could do some surgery in a time when surgeon skills were based more on how fast they could perform a surgery because there was no anesthesia, and so it was like literal torture. These people could also pull teeth. So if you had a toothache, maybe because your teeth came in contact with, let's say, an acrid humor and a urine gargle, real thing I read, didn't help. Well, at that point, you've tried everything. So the only thing left to do is for the tooth to come out. And I think we've all had the experience of having just terrible tooth pain. So you go to, like, let's say a market or a fair to find an itinerant dentist whose assistants would obviously be dressed up as clowns who would then sing songs to drown out the sound of your screams as the dentist pulled your teeth, which is apparently a real thing that actually happened. But then there were people like these guys who did see dentistry as something more in line with medicine. And by the 1800s, dentistry was its own thing, and you couldn't go to a single person to get your hair cut and a tooth pulled. But dentists were still more like tooth mechanics than doctors. Tiger here is actually missing one of his canines because he doesn't go to the dentist. So, the story goes that in 1840, Harris and Hayden approached the physicians of the College of Medicine at the University of Maryland with the idea of adding dental instruction to their medical course. How could dentistry be a thing if you can't even get a degree in it? But the physicians there were apparently not into it, and they rejected the idea. Apparently they didn't think that dentists were on par with medical doctors. So, Harris and Hayden opened their own school and granted the first dental degree only 5 months later. That was the world's first dental school. But it's at that point that institutionally dentistry became a separate thing from the rest of medicine. People along the way did attempt to remedy this and call attention to it. So in the 1920s, this biological chemist, William Geiss, comes along with a report that he presents to every dental school in the US and Canada, saying, dentistry can no longer be accepted as mere tooth technology. It's got to become part of the larger healthcare system. Even research in dental fields is regarded in important schools of medicine as something inferior. Now the issue, as far as I understand it, now I went to school for jazz, so dentistry was just a hobby for me. But the issue is not so much that dentistry is siloed from the rest of medicine. It's that dental care has been cut off from the rest of the healthcare system. And you're probably thinking, well, dentists understand this better than anyone. What have they done to remedy this? Well, in 1946, members of Congress were working on this bill that would establish a national insurance plan. So some people from the American Dental Association came down to Washington to testify as to how important dental care was and how any national health care program needs to include dental care. Is the story I'd like to tell you. Actually, dentists themselves have been some of the biggest impediments to synthesizing the healthcare system. Because what actually happened is that in 1946, when the Dental Association went to weigh in on the bill, they actually told the Senate they specifically wanted dentistry to be left out of the program because they said there just weren't enough dentists. I mean, there were enough dentists for people who could pay, but if regular poor people could go and get their teeth cleaned, there weren't enough dentists for that. But the ADA had solutions. They suggested a federally funded research into disease prevention and grants for community-level pilot programs for young people. So in other words, neoliberal distraction programs that are meant to blow off the real solutions. So in the US system, dental is secondary. Almost 70 million people don't have dental, and things like Medicaid and Medicare leave people out of the loop. Only about half of dentists actually take Medicaid because the reimbursement rates aren't very good. Adults who have private health insurance sometimes don't have dental, and then Medicare, for the most part, doesn't cover dental. So a lot of people just don't get to go to the dentist. But what happens when part of your bedtime routine is eating 3 donuts as quickly as you can so your body doesn't notice the calories? And then you refuse to brush your teeth because you don't want to ruin the flavor. But now you have toothpaste so bad that you're in constant pain, your jaw is swollen, it's unbearable, and you don't have dental insurance. Your only option is the emergency room. Dental visits to emergency departments nearly doubled in the decade between 2000 and 2010. Tooth decay, oral lesions, abscesses, gum infections, and related complaints were the reason for more than 4 million emergency room visits during the 3-year period spanning the recession years of 2008 and 2010. Now, as we all know, dentists are judged on 2 things: the modality of the artwork in their waiting rooms, and their fatality rates, because no one wants to hear a dentist say, "We were putting the strawberry polish on your son's teeth when his pulse started slowing and we lost him." But people do die from things that originated as minor dental issues. Nationwide, a total of 61,439 hospitalizations were primarily attributed to periapical abscesses during the 9 years between 2000 and 2009. A periapical abscess is an infection around the root of your tooth. The average patient stayed nearly 3 days in the hospital, and a total of 66 of the patients died. And this is the kind of thing that's way less likely to happen to you if you have a dentist you see routinely. Now, part of the problem is that there are parts of the country that just don't have dentists. In the US, on average, there are 1,538 patients for every dentist, but in certain areas, there are 20,000 patients per dentist. That means that if one dentist were to see 80 patients a week for 52 weeks out of the year, it would still take 5 years to see all 20,000 patients. One way we could expand care would be to expand the skills and latitude of hygienists. It used to be that hygienists couldn't do anything without the supervision of a dentist. So here's a question. When you get your teeth cleaned, it's a hygienist who does it. Let's say you have a population that's underserved and you wanted to make it so that a hygienist could come in somewhere, maybe like a nursing home or a school, and clean the teeth of residents who otherwise might not have ended up getting their teeth cleaned. Who would oppose that? Well, they tried to pass a bill in Georgia to allow for such a thing, and for some reason, dentists came out against it. At this point, most states allow hygienists to provide preventative care without the supervision of a dentist. But if we're talking about allowing hygienists to do things like give local anesthesia or perform restorative work on teeth, then the supervision requirements change state by state. But dentists have actually been quite opposed historically to allowing hygienists to work on their own, even in underserved communities with people who likely would have completely gone without dental care but for a hygienist coming to a school or a nursing home. Dental associations lobby legislatures to oppose these things because the dental lobby's primary concern has always been, and remains, the bottom line of dentists. This is why organized dentistry fought to keep dental care out of Medicare in 1965, and they continued to fight to keep it out of Medicare in 2021. So why the dental and medical fields are 2 separate worlds? That looks to be an accident of history, but I can't imagine someone would design it that way if they were designing the whole healthcare system from the ground up. And why they remain 2 different worlds, at least as far as coverage is concerned, organized dentistry bears a lot of responsibility. And the people who lose are the same people who always lose. But that'll do it for me. A lot of this video drew from a book called Teeth, The Story of Beauty Inequality and the Struggle for Oral Health in America by Mary Otto. So if this interests you, you should go and read Teeth. Highly recommend it. But the other thing you should do is subscribe to Breaking Points. And you can find me on Twitter or at my own YouTube channel where I talk about media and politics and other things. Link in description. Liking and sharing always help. Thank you to Breaking Points. Thank you so much for watching. And I will see you in the next one. Tiger, you want a donut? Nah, I shouldn't eat that anyway.
Hey guys, if you like that video, go to breakingpoints.com, become a premium subscriber, and help us build the best independent media organization on the planet.
That's right. We're subscriber funded. We're building something new. We want to replace these failing mainstream media organizations.
So again, to subscribe, it's breakingpoints.com.